Hello, I'm Dr. Yoon. If you're considering presbyopia-correcting cataract surgery, have you ever left the clinic and realized you forgot to ask an important question? Maybe you started searching for answers at home and came across this video. Today, I'd like to answer some of the questions my patients ask most often. Although inconvenient, presbyopia can usually be managed with reading glasses. However, with severe hyperopic presbyopia, reading glasses may require a very strong prescription, which can cause dizziness or eye strain. If that begins to interfere with your daily life, surgery may be worth considering. A cataract clouds the eye's natural lens, and reading glasses won't fix the blurry vision. In the past, people often waited until their vision became severely impaired before having surgery. Today, surgical techniques have advanced significantly, so it is reasonable to consider surgery once cataracts begin to interfere with daily life. In the early stages, if symptoms are mild, medication may help slow its progression. Your ophthalmologist can determine whether this is an appropriate option for you. So, if you have presbyopia without cataracts, and it's not causing significant inconvenience, surgery is not necessary. However, because cataracts become increasingly common with age, regular examinations are important. Your ophthalmologist can monitor their progression and help you decide when surgery may be appropriate. Floaters are small, dark spots, specks, or strands that seem to drift across your field of vision, sometimes like tiny flies moving in front of your eyes. They can develop for many reasons, including age-related changes, myopia, and retinal conditions. Many patients worry that cataract surgery will cause floaters. In most cases, however, floaters do not develop simply because cataract surgery was performed. If you suddenly notice floaters after surgery, they may have already been present beforehand. As a cataract worsens, floaters may become less noticeable. Once vision becomes clearer after surgery, those previously unnoticed floaters may become much more apparent. If floaters are caused by a retinal condition or suddenly become worse, appropriate retinal evaluation and treatment may be necessary. But when they are caused by normal age-related changes, treatment is often unnecessary, and most patients gradually learn to adapt to them. That's why it's important to tell age-related floaters from those caused by eye disease. Before surgery, a thorough eye exam can usually detect retinal problems related to floaters. At Gangnam Smile Eye Clinic, we carefully examine both the central and peripheral retina before surgery to look for floaters and any other retinal abnormalities. And if floaters were already present, they may simply become more noticeable once your vision improves after surgery. Astigmatism prevents light from focusing on a single point, causing blurry or distorted vision. It can generally be divided into two types: corneal and lenticular astigmatism. Because cataract surgery removes the eye's natural lens and replaces it with an intraocular lens, or IOL, any astigmatism caused by the natural lens is removed along with it. What matters then is whether there is astigmatism in the cornea. Total astigmatism reflects the combined effects of the cornea and natural lens. So even if your eyeglass prescription includes astigmatism, that doesn't mean you'll need astigmatism correction during cataract surgery. The key question is how much of that astigmatism comes from the cornea. If corneal astigmatism is present, there are two main ways to correct it. One option is a small, relaxing corneal incision. The other is a toric IOL. If corneal astigmatism is mild, around 1 diopter, it can be corrected with a small corneal incision. For a larger amount of corneal astigmatism, a toric IOL, designed to correct astigmatism, may be more appropriate. Occasionally, a small amount of astigmatism may remain immediately after cataract surgery. Some of this residual astigmatism may improve as the cornea heals, so it is often best to allow some time before evaluating the final result. As I mentioned, cataract surgery removes the cloudy natural lens. Once that lens has been removed, the cataract itself can't come back. However, posterior capsule opacification can develop months or even years after surgery. During cataract surgery, the front of the lens capsule is opened, while the back is left to support the IOL. If the back later becomes cloudy, causing blurry vision again, It's called posterior capsule opacification. Because the symptoms can feel similar, many people mistakenly think their cataract has returned. Unlike a cataract, posterior capsule opacification doesn't require another cataract operation. It can usually be treated with a quick YAG laser procedure that creates a small opening in the cloudy capsule, allowing light to pass through clearly again. Intraocular lenses come in a wide range of designs and optical features, so the choice can be tailored to each patient's visual needs. For example, some refractive lens designs provide strong distance vision with fewer glare or halo symptoms, while diffractive designs may offer a broader range of near and intermediate vision. In selected patients, a mix-and-match approach may provide a wider range of vision. However, patients who are particularly sensitive to differences in visual quality may do better with the same lens design in both eyes. For the best possible outcome, lens selection should be based on both your lifestyle and the anatomy of your eyes, following a detailed consultation with an experienced ophthalmologist. Once the dilated pupil begins to return to its normal size, most patients can resume basic daily activities by the day after surgery. If the cataract was very advanced, temporary corneal swelling may cause blurred vision after surgery. In most cases, this gradually improves over the next few days. You can generally resume light daily activities the day after surgery. However, if you work, we recommend taking 3 to 4 days off before returning to work, as this may help support a smoother recovery. Before multifocal intraocular lenses became widely used, most patients undergoing cataract surgery received monofocal IOLs. A monofocal IOL is typically set to provide clear vision at run distance, most often far away, so reading glasses are usually still needed for close-up tasks. Some patients later come to us hoping to have their monofocal lens replaced with a multifocal one. In principle, an IOL exchange is possible. If the existing lens has not become firmly attached to the surrounding capsule, it may be possible to remove it and replace it with another lens without excessive difficulty. However, an IOL exchange can become more difficult when a significant amount of time has passed since the original surgery. Over time, the lens may become firmly positioned and adhere to the surrounding capsule and tissues, making removal more technically challenging and potentially riskier. It is also important to know whether you have previously undergone a YAG laser capsulotomy. Once the posterior capsule has been opened with the laser, an IOL exchange becomes considerably more complex. That's why choosing the right lens from the start, based on a thorough preoperative evaluation and your visual needs, is essential. I hope you found today's information helpful. If you did, please like this video and subscribe to our channel. And if you have any other questions, feel free to leave them in the comments below. See you in the next video.